Ask Nutritionist Deepa's podcast episode. I have a very special guest today. As you guys know, I like hearing stories, and through my patients, I get to hear a lot of stories and to some extent become part of their life on some level. And so today, my guest Dan Flores uh, is my guest who came in as my patient, and we started working together, and his case has inspired me to continue doing what I'm doing, because sometimes as a provider we feel, oh my god, I wonder if anyone is listening. But Dan gave me that hope, because he came with bunch of stuff and some food allergies, but I'm going to have Dan discuss that with us. So welcome, Dan, and let's get right into the episode. So thank you for joining today.
Yeah, thanks for having me. I appreciate it.
Okay, so Dan, before we, we like to hear stories. So I want you to give our audience, our viewers, a little bit insight into what made you realize that it's worth investing in your health, and it's worth doing it, and you can do it. Take us back to October. That's, I believe, the first time I saw you.
Yeah, it was October of last year, 2019. So yeah, like first of all, it's very humbling to be on your podcast or to even be asked like that. When I told my wife about this, she kind of laughed and was just like, "Wow." She's like, "Yeah, that's you've come a long way. That makes sense." And I was like, "So it's very humbling. You don't think that it makes an impact or people notice, right?" But so I appreciate that. To kind of get into the background of what you were saying, the story. So I've had a lot of health issues. I've dealt with obesity for my entire life. I mean, it's been an up and downhill battle for me since I was a kid. Honestly, the peak of my healthiness, I would say, probably would have been in high school when I was very athletic, and I was by myself. I didn't have kids. I didn't have a job. I was just a young teenager and just had ambitions to be really good at sports. So and when you're obviously a lot younger and you have more time on your hands, things are easier to do. So, so I always wanted to kind of get back to that, to my glory days. And I had experienced a lot of health issues, leading up to meeting with you. And what kind of triggered it was my physical therapist who had seen you previously. And him and I talk a lot about, veganism, because I'm a vegan and been doing that stuff. And he's like, Dan, you keep coming in here with an injury. He's like, you had torn meniscus, and then later on that year, as Deepa, I sprained my ankle like really badly. So there was a lot of physical abuse in my body that could take so much. And I'm 36 years old, and I started realizing that I'm not really as fit as I should be. It was really holding me back from playing with my kids, being able to do stuff like football or just doing fun things like that. Then there's also I've been battling with a lot of digestive issues.
Yes.
I mean, very severe digestive issues, to the point where I was constantly going to the doctor. Probably saw like 3 different GI doctors, different pills, you name it, like omeprazole, Zantac, as we all know, that now that's like a big deal, right? I mean, I was on that. I mean, all different types of medications for that. I mean, constipation, diarrhea, bloating, just not feeling well.
And low energy. That's
low in energy.
That
Absolutely
stuck in my mind that you said
yeah.
Sitting in the office for the first visit was work.
It was.
It took a lot
it
of
is. And it's not like the energy, it's just like feeling down all the time.
Yeah.
You know what I mean? It's not like you're tired, like you want to go sleep. It's just everything's very slow, and you don't realize, like you said, like I said, you don't realize that you're this person because it's become the normal to you, right? And it took, like I said, my physical therapist was like, Dan, you really should see a nutritionist, and this is kind of where I had kind of made a turning point and said, I want to lose weight. I want to keep it off. So I joined a gym and got into some coaching there, for the physical aspect. But he told me, he's like, and he was also helping me with my therapy. So he was kind of my coach too. But he's like, Dan, you really need help for your nutritional aspect, what to intake and what to eat. And I've always been that person, like, I don't need help. I could do it by myself. But I think that it kind of took that awakening of like him kind of telling me, like, look, you have all these GI issues. You shouldn't be going through this at your age. You're not dying of cancer, because I thought I had cancer. I thought there was something wrong with me, right?
Yes.
Because that's the only thing that could make me feel bad. There's something,
Correct.
I'm dying of cancer of some sort. I mean, I've spent so much money on pills, on procedures. I probably had 3 endoscopies, 2 colonoscopies, all within the last 5 years, and I'm 36 years old.
Correct.
And they found nothing. We're talking about emergency visits, scans, I mean, ultrasounds, MRIs. I mean, I'm exposing my body to all this stuff, and they found nothing. And I keep saying, no, 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 you're missing it. You're missing it. But really, I was the one that was missing it. I was missing the point.
One quick question. So you were vegan since when? Because
I
this
would,
was happening while you were vegan?
yeah, that's the funny thing. Yeah, so it's 2020. So I probably started vegan, I want to say the end of 2017. I want to say probably like 2018. I was introduced to, veganism,
Okay.
and 2018 would have been my launch year.
Okay. So this was happening. You thought that going vegan would help you,
Yes,
and you tried your best with the diet, but obviously there was a missing piece.
correct. I lost weight, but I was still experiencing issues.
Issues.
GERD, digestive issues, GERD, acid reflux. I mean, everything you name it. It
You
wasn't,
had
the
it.
pipes weren't working.
Correct. I agree. Stomach issues, all those things. I remember. So fast forward to October. You speak to your physical therapist. We meet. Uh, what happened then?
It was, oh,
Was
I'm
it
sorry, go ahead.
the allergy piece we discussed at that point, or no?
You had introduced that to me, the food allergy with the gluten. I just kind of came there thinking that I was going to get a recipe or a one pill thing that would kind of fix it all, right? And when we sat down, you kind of did your diagnosis on me. You kind of asked me all these questions, and to me, it was very eye opening, because I learned right there in that moment, and as in our journey together, that everyone's different, right? And there's not one thing that's going to fix everyone. Everyone's made differently. And so you kind of helped me discover the gluten allergy. That was the biggest thing that kind of caused the digestive issues, probably the low energy and you kept saying it, and you said, you're not absorbing it right, Dan. You have really bad absorption. I mean, that was like, what are you talking about absorbing, Yeah. So that was really big for me, because it took a while, right? I mean, we took multiple visits and trying this and kind of starting from scratch and eating bland and introducing new things. And there were things that I didn't even realize that were affecting me outside of gluten, right? I mean, we discovered gluten, we discovered dairy, any type of dairy, the vegetable things. Remember that I couldn't process raw vegetables.
Raw vegetables, eating cooked vegetables.
Yes.
Eating smaller portions.
Smaller portions. That was a big, I mean, remember, I never forget, I told my wife, I was like, Deepa made me feel like a 3-year-old, because she like gave me these like 10 almonds, and I scarfed them down in like 2 minutes, and you're like, that should have lasted you an hour. And that was like a test, and that's how I eat. I mean, I eat like if I'm in jail, like if someone's gonna take my food, I mean, I'm just constantly shoveling it down. So that was a big eye opener, just to kind of take your time and eat slowly and process, like your food digest,
Correct. That was, and people, please understand that our body, it has immense ability to 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 respond, because it wasn't like Dan had to do this for a year or see me 100 times. First 1 or 2 visits, he followed what he was supposed to do. I basically told him that if doctor prescribed you a medication, we take it, right? We take it.
Mm-hmm.
If doctor says wake up in the middle of the night at 3 o'clock and that's when this medication is effective, we take it. We have to treat food as medicine. We have to take nutrient dense food as 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 a pill form, in the sense that follow the prescription. This is just a food prescription,
Hmm.
and that is important, because after that Dan took control on his own, and he kind of did really well on his own. So Dan, give us little more context into some of the ups and downs, and this COVID thing happened, and how do you deal, you are a busy dad, you are a husband, you have other responsibilities. So how do you practically live this lifestyle?
Well, I think the first thing that I kind of took off right off the bat, I think that was the first thing, is just kind of accepting help, accepting that you can't do this on your own, especially if you're someone like me who's been battling, obesity since you were a kid. And like I said, I've had hills and valleys of losing weight and then gaining back. I mean, up and down, up and down. And I just think that it's, you kind of hit it earlier, Deepa, like you got to treat it like you're like food, like it's a doctor, right? Your body needs help, and you're not all knowing. There's people out there that study this, people like Deepa that have been doing this for years, went to school, have treated numerous patients, with food. And it's just kind of accepting that you need help, right? So you got to want the help, and you have to be open to the help, right? I think that was the biggest hurdle out of all, which is a mentality thing, is kind of saying, hey, I'm here, Deepa, help me, I'll do whatever you ask me to, you know and even with my training. So you have to be open to receiving outside help. You can't do this on your own.
So
um,
commitment.
the commitment, exactly, commitment, and the loyalty to, and the respect to the people that are helping you. I thank my trainers at UFC gym for helping me. I definitely thank you for helping me a lot, and even my physical therapist. I mean, there's a community of people that are on your side that want to help you. And like they say, it takes a community to raise a kid. It's the same thing. It takes community to get healthy again. It's not an easy feat. I mean, you're talking about years. I'm 36 years old, so we're talking about 36 years of eating bad, of trained eating habits that you're going to have to unravel. So that's going to take help. It also takes a commitment, and I think, again, listen to Deepa. She was like, I want you to bring your family here, bring your wife here, bring your kids. I don't care if your kids are crazy 3, 4, 5 year olds. I have toys here. This is a family thing. And she was right, because it's not only going to benefit me by having my family buy into it, but now you're training a younger generation, like my kids, to learn how to eat like this, to learn that taking care of your body is very important. So once you kind of get all that around, it's definitely better. I mean, then you kind of have to just train yourself in terms of changing your lifestyle and understanding that, again, the commitment you said, Deepak, that this is not a one-time thing. I'm not just going to take this and all of a sudden I'm going to be losing weight forever. This is a lifestyle change. Like the next 36 years of my life have to be like this, so it's the Noom app that you kind of gave me is kind of tracking my food and making sure that I'm tracking myself, because you'd be surprised how those calories add up. You'd be surprised. So it's kind of like someone that's watching you, and you're kind of able to maintain and eat while you can, but also maintain a healthy balance. Um, some of the hardest stuff, I would say, especially now, is you have to be active, right? And you have to be always wanting to not only be active physically and training. It's just like when you get bored of a workout, you want to mix it up and try different things. But even with food, right, you have to be inventive, and you have to also want to try different things, and again, be open to people like Deepa, because I'd be like, Deepa, I'm bored. She's like, all right, try this recipe, try that, and it's really kind of taking ownership of that, and again, just having that community. She put me and plugged in on Facebook with this vegan gluten group, which people there have similar experiences, and we're sharing recipes. I mean, I go there and I get different recipes. So again, it's just kind of always being active with that, and always being willing to try different things. The hardest thing about being locked down with COVID, and again, this is not gonna stop. This is a forever thing. This is a marathon. And I want to keep saying that because again, I would do something and I would come up and I would come down. You have to understand that you are forever have to be like this. You have to be conscious of what you eat. You have to be conscious of working out, you know?
Absolutely. Uh, and then, Dan, since then, tell us how much weight you have lost, how much you have been able to maintain, and of course, your overall signs and symptoms improved. And
Yeah.
how do you feel? I mean, what is it worth it? I mean,
It,
obviously,
it's
you.
very worth it, honestly. So when I saw Deepa, I was 290. I'm now down to 250. So that was back in October, and we're now beginning of May, right?
Yeah.
So I've lost 40 pounds, and
Yes.
it was a hard 40 pounds. The thing about it is that I've been maintaining that. I've lost weight. I've lost 40 pounds in 2 months before, but then I've gained 50 of it in a month, you know? Um, so I've been down to that, but again, the weight loss has always been there for me. It's the improvement of my life, of my digestive system is way better than it used to be. I don't take any more pills. I don't take even my anxiety has gone. I used to be on omeprazole. I used to be on Xanax. I don't take that stuff anymore. That's gone. You know, um, my energy is way better than what it used to be. I used to have inflammation that I didn't realize, and everything like I remember within a month, 1 month of being with Deepa, she was like, Dan, you look completely different. Like your face is swelling, your wrists, everything is down. My rings weren't even fitting on me, and I had maybe lost like 10 pounds at the time. It's just a whole different quality of life, you know. And the thing is, now that my body's adapt to it. So like you mentioned before, when this whole COVID thing, I couldn't go to the gym, I couldn't see Deepa. There's a lot of stress in your life. I mean, I lost my job during this time, so there was a lot of stuff financially that was hitting me, and it's very easy to kind of go back. I mean, food could either be a medicine or food could be a drug, and I started reusing again. I kind of relapsed because, like
Yes.
anyone else would do. But again, I talk about that community of having people to help you, and having someone like Deepa, because she was persistent. She was like, Dan, I want to talk to you. And I was like, I don't want to talk right now. I got a lot of stuff going on. But she was there supporting me in my corner. And she didn't scold me. She's like, listen, okay, you did what you did. And ironically, I really didn't even gain any weight. But
No.
I started feeling down again, the symptoms. So your body's like telling you, Dan, what are you doing? I don't like this anymore. We're not used to that. We're used to this new Dan. So it was nice to have Deepa kind of reel me in and say, hey, this is what you could do, because I didn't have any of availability to fresh produce, right? We're on lockdown and we're trying not to expose ourselves. So she gave me some tips on what to do. Like, listen, well, you could do this, you could do that, use frozen stuff, use frozen that. And it was nice to kind of get back on track, you know. So it is harder now that we're on lockdown, but again, it's a mentality thing. I mean, you have to want to change, you have to want to be committed, you know. Go for walks, you know. Technology, there's so many technology things right now that you could do working out. Deep and I did a Zoom visit. I mean, yes, it's different, but it's not the end of the world.
It's not end of the world. And the important thing is to really understand, like you were saying, that life is going to happen. You fall off the wagon,
Yep,
and most people don't seek help when they are off the wagon, because they feel, oh, somehow I will get back on and I will continue. But it doesn't have, the behavior change needs lot of nudging, at least first 1 year. Okay.
absolutely.
because things happen. I mean, COVID was a completely uh, out of nowhere.
Yep,
If it weren't COVID, it would have been some holiday and people fall off the wagon because of the holiday. It could be some life event, stress. So I think what I'm also listening from you, Dan, and learning that mindfulness of, not only about I need to change from how I'm going to change it, whom I'm going to get on my team. I mean, your wife plays a huge role. in this,
Yes.
in terms of planning, and you all came to the office, and this is not this plan has not worked out if we had not planned things.
Correct. Correct.
So tell us a little bit about your, like, how you plan your meals, and how
Mm.
you actually execute.
So
What are some of the tips for people who are listening?
I'm a big planner in general, so that's kind of what I do for a living. So the biggest thing is like I said is giving in. And when I went to Deepa, she had given me a like a meal thing, and it was very like, it wasn't like specific to the T, like eat this at this time. It was like in the morning you have these options. You want to oatmeal, or it was like a slice of total avocado. Then you want to do your sex. You kind of gave me a a blueprint, right, on kind of how to plan your day. To me, that was very helpful. It really was, because then it kind of gave me things that what type of things I should be eating, whether it's fruit, how much like oats I should be eating, stuff like that. How much fruits you should be having, how much that. So once you kind of gave me that blueprint, I've kind of stuck that and adopted that to my everyday living. And again, like my whole family and I did that. Um, the biggest thing that, and I think it makes sense for someone who didn't absorb well, was shakes. Like, and I told you, remember when I had relapsed for like that month, I was like, I don't have my shake, Deepa. Like, I don't have fresh
That smoothie.
spinach. That smoothie, yeah, that was like my life. That's my foundation, and it really got me going. So basically, I plan every morning. I do a shake, right? And I love it. It's spinach. I had kale, dates, blueberries, a little bit of pineapple, almonds. You could pick any type of. I like almond milk, or you could do soy milk, or oat milk is phenomenal. If you really want something that's creamy, a little more filling, oat milk is really good for you, or at least for me, what I like. So I do a mixture like that, right? So I start off my day every day with that. That's a must.
Mm.
Every day I have to have that, along with the different vitamins that you've given me. Like D3 deficiency that I didn't even realize. I mean, I'd seen Deepa. She's like, go to the doctor. I guarantee you're low on D. It was like lowest could be. I mean, I don't even have the numbers. It would.
I
Remember,
think
you
it
were.
was intense, because I
Yeah.
said your
Yes.
symptoms indicate that you are
Yes.
probably between 10 and 15, and I think it was like 16, 18, something.
Absolutely. That was it. So D3, vitamin C, multivitamins, a probiotic that you gave me to help with my stomach. So all that stuff, again, you have to get in that mentality. So I wake up, I take my vitamins, I take my shake, then I do a snack. But you really have to meal plan this out. In the first month, it is kind of hard, because you're buying all this new stuff and you're trying different things. Again, everything that worked for me might not work for everyone out there, but you have to be listening to your body, and you have to document it and talk to your team. This is what I noticed. Like, remember, seeds really affect me. Corn really affected me.
Correct.
So once you kind of get that once you kind of filter all that stuff out, then you kind of get in a rhythm. You know what I mean? And you really just, I meal plan. I have my foundation is the shakes, then I do a snack time in mid morning, then lunch. I'll have like a little bit of rice, brown rice with some beans, and then I have my snack in the afternoon, and then I have my dinner, and then you have your evening snack. So really, I was eating a lot in portions. And I was like, man, this is like, so I thought I was gonna be starving. I was like, man, Deepa's gonna kill me. I'm not gonna eat anything. But no, like I couldn't keep up with the eating, But it's portion control. It's not the one thing I learned, and it's kind of applied in life in general. I always tell people, so I use my own advice against me. And my wife's like, yeah, it's not what you do, but it's how you do it, right? You
Yeah.
could eat as much as you want, or you could eat whatever you want, but it's how you're eating it,
Correct.
and that was the biggest thing. I didn't know how to eat food right, the timing of it, eating like fats with certain fruits, or take vitamin C with spinach for absorption. It's stuff like that I didn't know.
Um, s- so then how did you, or how do you uh, battle temptations? What if somebody drops off a big tray of brownie right now, or someone orders pizza?
Yeah, I called Deepa. No. No. You know, I,
What
I
do you
think
do with the brownies?
yeah, the biggest thing is for me, there's a couple layers. It's like, I want to live. I remind myself the life that I used to live, the pain that I had, all the stuff, right, that affected me, and understand that I have this better quality of life. And again, it's not perfect. It's still getting better. I've only been doing this for like less than 6 months. So if you can imagine the 36 years that I lived like this, I want the next 36 years to be better. So if I'm feeling this better in 6 months, can you imagine what a full year would be like? So it's stuff like that that I think about. Again, the Noom app is a huge thing for you, especially as a beginner, because you track that. I mean, there's stuff that I'll put in and be like, okay, what if I have a slice of brownie? And you put that in, and you're like, your whole day's ruined. Then you can't eat anymore, you know? And you kind of get used to liking. I think that it's important to be inventive with the different foods that you have, because a brownie is not as good, honestly, as some of the stuff that you eat, especially having someone like Deepa or a team member like that that gives you different recipes. Like, oh, this tastes better than a brownie. So sometimes you don't even want that. And then you know what? Sometimes if you do fall, I don't know how you feel about it, but sometimes, hey, all right, you give in. But it's again get back on the horse, right? You're
Absolutely.
tracking yourself. You know what I mean?
Absolutely. And I tell, correct. I mean, I tell people all the time that, believe me, if you start eating clean, 6 months from now, if somebody drops off that tray of brownie at your desk, you will not enjoy it as much.
You
Food
won't.
does not taste same. It tastes too sugary, too
Yes.
sweet, too heavy, and
Yes.
it's not fun anymore.
It's
So
not.
it's not, because I tell everybody, guys, I don't want you to be my lifelong patients. We can be friends. That relationship will go on, but not as patients. My job is to graduate you, which means that I don't want to be your food police. I don't want you guys to do things because, oh, Deepa is going to uh, say something about it, because your body is your police.
Hmm.
Because the last little bit of a frantic call with Dan was, it was after eating something accidentally, or maybe not accidentally. You tried small piece of pizza or small,
Yeah, that's what it was. I had a piece of the kid's
and
pizza.
his body screamed at him. He just called me to tell him that, hey, it wasn't, Deepa, I don't need you to scream at me because my body is screaming at me. So
Absolutely.
so that wouldn't have happened if he didn't have a that mindfulness.
Hmm.
So no, this is very motivating. And I decided to have you on literally because, as a provider, I always feel that if this story is going to change one more person's life, it will be worth your time and my time and all the effort that you have put in. Because I just give tools, but real heavy work is done by the patients, by you guys. And you have taken it to the next level, because lot of health issues, and this whole gluten free lifestyle is not easy.
It's not, but even being gluten free, you lose a lot more weight because you're not eating a lot of bread. I think the biggest thing is that when you have a team like that, it's a community, friends, like you said, it's not just like this doctor-patient relationship. It's more like a family.
Yeah.
You don't want to let these people down. I mean, you people that are invested into you, that really care about your well-being, that check on you, you know, you don't want to let them down, and they're just like family. You don't want to let your family down. Again, you hit on the head, Deep. I mean, we have to start treating food like medicine. Food can heal us. I mean, I don't go to the doctor as much as I used to. I don't have all these anxiety episodes. I mean, I feel like I don't have to have like scans and all that stuff. I mean, I think it's important that we take like for instance, we go to a doctor at least once a year for a checkup, right? I think everyone should see a nutritionist once a year. I mean, that's honestly my plan. I want to meet with you once a year, Deep. Say, hey, hey Dan, how things are going, what's up, this is what I'm doing. I mean, I think that's very important. I mean, it's a lifestyle change, or even a culture change that we need to kind of take on, because if we would eat better and if we would take that seriously, I think a lot of the problems that we have as Americans, we wouldn't be having these issues like we have that now. People are, I think it's funny because there's this whole thing about this meat shortages
Yeah,
that's going to be happening. I think that's hilarious because I'm like, watch, people are going to start eating vegan and they're going to start seeing the changes in their life. And I'm not saying that everyone should be vegan, but the meat consumption in this country is out of hand. And I think that people are going to see the different alternative and eating clean,
yeah,
right? You can maybe have a piece of meat here and there once in a while, but understanding the benefits that they're going to receive, and even how much cheaper it is,
correct.
and it's going to be amazing. I can't wait to see it. I'll be honest with you.
That's true. Talking about cost, I wanted to get into that little bit.
Sure.
People always say that, hey, eating healthy is expensive. What is your take on that?
Well, if you're taking, I always like to compare it like paper to paper, right?
Mm.
If you're taking food, right, compared like all the meat and all that stuff to eating healthier, depending on the quality of stuff, and again, I think this is a cultural thing. Once this becomes more available and more frequently, you'll see the cost come down.
Mm.
But I compare it to your hospital bills. I compare it to your medications that you're taking monthly, bi-weekly. I compare it to the emergency rooms or the procedures that you have to have. You know, that it cost outweighs anything. But if you really want to break it down, it's not that much more expensive. And honestly, the the food lasts longer. You know what I mean? We're talking about beans and lentil stuff. You could get dry beans. I have dry beans I've had for over a year and they're still good. There's frozen fruits, there's frozen vegetables. I mean, obviously fresh is better, but you could get that type of stuff.
Yeah.
Even the pastas. Oh man, pastas done wonders for me, like lentil pasta, where you get your protein, and like your bread that you need. There's all different chickpea pastas,
Yeah.
all that stuff. You know what I mean? Potatoes, sweet potatoes, all that stuff lasts a lot long. And again, do you really want to think about it? Do you really want to be putting food in your body that freezes or unfreezes, or that's overly processed, right? Like honestly, I could make a vegan meal, and I could leave it in my fridge, and it'll be there for a week, and I can eat it in a week. It'll smell the same. It'll taste just as good. Sometimes it even tastes even better.
Better
Meat,
because the herbs and spices sink in.
yes, exactly. But like meat and stuff like that, 2 days you gotta throw it away, or it tastes bad, or it looks bad. You know what I mean? So
Absolutely.
it has a longer shelf life. I mean, I, I, I don't think it's that big of a deal, honestly. I don't see the cost. If I think that you get what you get, you buy what you get, and it's gonna last you longer, and it's gonna make you feel better. I mean, it's not that big of a difference.
Absolutely. No, Dan, I'm so glad that I was able to have you over on this podcast episode, because it's not only about giving people hope, but it's also setting up an example that this is doable. It's not difficult, and the importance of community. And I personally feel when you change one person, I'm sure Dan has helped his wife change, his kids are going to change, and maybe his friends and his family. Somebody is going to ask Dan one of these days, hey Dan, so what are you doing? And if he shares his knowledge, because knowledge is power, knowledge is
Yep.
another medicine. If you have right knowledge, it can
Yeah.
cure things. So it's a ripple effect, and that's exactly what we need right now, because
Yep.
this COVID crisis has again have identified the issue of chronic conditions, that most of these people who are suffering or have died from the COVID have blood pressure and obesity, diabetes as an underlying conditions. I can see only X number of people. I can touch only X number of lives, but my goal is to have this helping hands, these messengers out in the community who can spread the message. Really, that's what it is. So Dan, you have a last shot at the conversation. Give us your parting advice as to what will you tell people so that they can start making the change, or those who are making the change can maintain it.
Yeah. I'll say this because I'll touch up on it because I think you said it perfectly. I think the biggest thing is a community, and it's about changing, getting the help, reaching out, getting help that you need. Getting help from a dietitian, getting help from some kind of physical coach, whether it's joining a gym or something of that nature, is kind of opening yourself up and building a team together. You cannot do this by yourself. You need a full team, and there's people out there that want to help you. And it's give and take, right? Because I've received, but like you said, Deepa, now I'm giving because it's my whole family has changed. My wife has lost 20 pounds since we started this, and she's a fairly healthy person, but she was 155. She's down to 135. I mean, probably when we got married, my kids in the morning, they wake up and they say, Daddy, are we going to have our shake? I mean, talk about parents that trying to get their kids to eat vegetables right there. I mean, they cry if I don't give it to them. They're crying about it. They're like, Daddy, we need our multivitamins, which is, Brazilian nuts and dark chocolate and their vitamins. I mean, it's a whole cultural change. It's a community thing.
Yeah.
And I think that that's important. I think that you're not going to change yourself, but you're going to help change others, whether it's your family, whether it's your friends, whether it's a coworker, you just, like you said, you never know whose life you're going to change, right? And a time right now where we talk about a virus that's very contagious and spreading, so can this lifestyle change can be contagious and spread to others and help others, because the more people you get on board, the easier it becomes, right? If your family is doing it, if your friends are doing it, if your coworkers in the next cube are doing it, and I've seen that where I've go walking before all this happened. I grew from me to like 6 other people. Cause like you said, Dan, what are you doing? You're
Yes.
like looking good. Like, can I go for a walk with you, or can I try what you're eating? The possibilities are endless, but it has to start with yourself. You have to say that you want to change, and it's not just a change, it's a lifestyle change. You have to undo and retrain yourself and understand that you're being reborn again. It is a new life, and it's going to be a long life, God willing, but you have control in that. You have the control to do the right thing. So that's what I would say. So don't be afraid to ask for help. We all need help. There's nothing wrong with it.
No, thank you. And I'm glad that you're taking care of your kids, because that's another passion of mine, is to make sure that our kids are eating right food at home and at schools. Because
Yeah,
if if the risk factor, this chronic disease is a risk factor for COVID and any other virus that is in the pipeline for us, then we must make sure that our kids are eating right. Because currently, if you look at what they're eating at school, it's horrible.
horrible.
That kind of food is not designed to build immune system. So I'm so glad that you are setting an extremely good example for your kids. Because many times it happens that parents are following a diet, but for kids they make alternate meals, and that's
Hmm.
not the right message. Okay, we should not feel guilty for not giving our child pizza and chicken nuggets and mac and cheese every day.
Right.
We should feel guilty if they are not eating vegetables. So I thank you for involving your kids, your family, your friends, and continue the message. Please be just keep going. And thanks again. And we will be in touch. And everyone out there, please take Dan's story as an inspiration, as a motivation, as a turning point. If you're trying to make a change, or if you're just kind of on the edge there, and we will see you on the other end. We are here to help. Thank you, guys.